Hey, everybody. Welcome to this episode of the Future of Medicine podcast. I am your host, Dr. Wenzel, and I'm joined, as always, by the lovely and talented Jen Justus.
Hello.
Hello, Jen. In this episode, we're going to be talking about alcohol. The name of this episode is An Honest Discussion About Risks versus Benefits of Alcohol. And in this first section, I want to talk about the benefits of alcohol.
Okay. I'm sure there are many.
But I mean, here's the thing, right? Like, there are benefits of alcohol, otherwise we wouldn't consume it. So the real question is, what is the benefit? And before someone jumps through the airwaves into this microphone and punches me in the face about benefits of alcohol, like 99% of the time that you consume alcohol, it is being consumed with an intention. And for most people, that intention is some form of winding down, landing the plane, I call it. Very few people drink or consume alcohol for no reason at all.
Right. Then we're getting more into the addiction realm.
Well, yeah, I mean, that's a whole different discussion.
Yeah.
That's a different discussion. But 2 years ago, I made a video in this office, just me and a camera, and just feeling compelled to share about how most people are underestimating the impact of alcohol. And I've made hundreds of videos. And that one I took about an hour to plan, and I just did it. It's far and away, by orders of magnitude. I don't know if popular is the right word, but it's been consumed. I mean, it's really kind of remarkable. As you know, we don't promote any of our stuff. We just put it out in the world, and if people like it, they like it. We hope they like it. We hope it's useful. But the amount of hundreds and hundreds and hundreds of comments that this is a topic that really needs and deserves a little more time. And it surprised me as I was going through our bank of content. We hadn't actually formally created any content for this show or a formal blog post around my thoughts, our thoughts about alcohol and how it fits into one's health journey. So that's why we're doing this episode. So I think this will resonate with a lot of people. And this is not going to be us telling folks to stop drinking. Instead, I really hope that at the end of this, folks would have a framework with which to think about how does alcohol fit or not fit into their health journey. So why don't we first talk about why is alcohol such a challenge? I mean, are there things about it that make it a unique challenge in our current state of things?
Yeah. I mean, first of all, I think it's normalized to have a drink with dinner, to have a drink at a barbecue, or even celebrated, right, at weddings.
For breakfast?
Maybe breakfast.
Brunch cocktails?
Right. I recently went on vacation, and there was a lot of alcohol consumed by a lot of people around me.
But not you.
Well, I did, yes.
Something about Cabo?
Yeah, a little bit. But, the point being, when you're on vacation and you let loose a little bit, alcohol's there. And it's also legal. One of the few kind of drugs, if you will, that is these days. And it's really a go-to drug for feelings. So you can drink when you're happy. You can drink when you're sad. You can drink when you're bored. Similar to eating. A lot of people soothe their insecurities or feelings that they're not comfortable with food. Same goes for alcohol. A lot of people do consume it for that reason.
Yeah, I think, people are trying to achieve a certain state or a certain feeling when they consume alcohol. Right. And it may be different states and different feelings. But the North Star from most people who drink most of the time is, I'm in a less ideal state currently. And through the consumption of alcohol, I aim to achieve a more ideal state.
Yep.
And it's quite effective, actually. Otherwise, people wouldn't drink.
Right.
This would not be a discussion. And the science behind it, this is not a biochemistry lecture, so I'm not going to spend a bunch of time on this, but it does warrant just a little bit of attention. The reason alcohol is so effective at changing one's state is that it has direct impact in the brain on two pathways, one called the dopaminergic pathway and the other one called the GABA pathway. And the GABA pathway tends to slow us down, and the dopamine pathway, as I've referred to it, is kind of the pleasure center of the brain. It is actually, I call it the sex and chocolate. It's all of the things that create joy and warm, fuzzy feelings in us tend to stimulate the dopamine pathway. And alcohol is uniquely effective at stimulating both of those areas of the brain. In the next section, we want to talk about, okay, great. So we've identified kind of like the benefit of drinking, which is that it changes one's state from a less ideal to a more ideal state. But unless you don't drink at all, or you maybe have 1 or 2 drinks a year, which effectively means you don't drink, most people are grossly underestimating the impact alcohol is having on their health journey. Because while it's great at affecting and changing one's state in a very quick period of time, it comes at a ridiculously underappreciated cost. And that's what this section is going to be about, is like, what is the cost? There are actually 0 health benefits outside of the perceived change of state from less to perceived more ideal. That's even debatable. And really any attempt to explain to a human that a behavior like alcohol consumption actually has some redeeming value, even if there's incremental improvement in health that studies can show, that's like, you just can't tell a human that alcohol is healthy and expect them to actually apply that, because we are a very, very intelligent species, but we also follow the path of least resistance. And we tend to lump either all good or all bad. And so unless you tell me it's all bad, it must be good. And if you tell me it's even a little bit good, I'm going to go all in on that.
And so you may be referencing like the misnomer that, well, red wine has antioxidant benefits, or
I mean,
it'll
I guess
help you live longer.
To me, and maybe I'm not qualified to talk about this, but this is just my point of view. It's similar to saying, if I had $1.25 and you gave me 5 cents, I would now have $1.30. That's more money. And more money is better than less money in general. But $1.30 versus $1.25 feels like the same number. And if you're telling me that extra 5 cents comes at a tremendous cost, is it really a benefit at all? Can you really actually ethically say it has benefit? And so for me, the benefit of alcohol is a change of one's state, emotional state. But it comes at a high cost. And this is really about what those costs are. And to me, there are 3 major areas that it affects. One is our nutrition, one is the liver, one is the brain. I have spent countless amounts of hours creating content around my thesis around nutrition. What I will say about alcohol is that alcohol bears with it potential energy known as calories, just like all other nutritional sources, protein, fats, and carbs, also have potential energy in the form of calories. But the body is uniquely formed to convert those calories from protein, fats, and carbs into actual usable forms of energy. We're omnivores, which means we can eat anything. In the right environment, we can get what we need out of whatever we put in our mouth. But then alcohol comes along and we have this empty calorie phenomena, which means in English, we don't have a pathway to take these calories that come attached to alcohol and actually convert them to usable energy. And all things that don't have a pathway to be metabolized get kicked off as a toxin and diverted. And this is where it gets interesting. Although empty calories certainly create some challenge with our health journey, specifically around weight, metabolic disease, what I think people need to hear is what you're about to talk about, which is when those calories get diverted off, they go kicked off to the liver to be processed as a toxin. Talk to us about what happens at the liver.
Well, at the level of the liver, and we see this a lot, and I always go back to relatable stories in our podcast with our members, right? Because
Are we going back to Cabo?
no,
Oh.
maybe. That, when I meet with a member, or I'm sure when you meet with a member, and they're doing everything right, supposedly, I'm tracking my calories or macros, I'm working out 3-4 times a week, I'm, doing everything right, sleeping 8 hours, all that. I always ask them about alcohol, and it's always underestimated. And we see it in the blood work when it comes back. So at the level of the liver, as you mentioned, it actually blocks a lot of the cholesterol mechanisms that we have in our body. And we've done lots of content around cholesterol. It's necessary for life. We have to have it. But what happens is it blocks cholesterol reuptake, the metabolism that our body does of cholesterol, and our triglyceride metabolism. And we see that in the labs. We'll see elevated triglycerides. We'll see elevated liver enzymes. So again, the liver's main, one of the liver's main jobs is to filter out all the toxins. And if it recognizes alcohol as a toxin,
It will stop doing all of the things.
It will stop doing all of the things. Yeah.
And so while the calorie is an interesting conversation, and it's usually the one everybody lands on, and then the discussion stops there, that's really only the surface of the deal. The real damage done by alcohol in our health journey is takes place at the level of the liver. And frankly, long after we have experienced the benefit of the mood or emotional state change, we are still paying for the alcohol.
Yeah.
The liver is just overwhelmed until it's completely caught up and it's processed. The next area is the brain. Alcohol, it doesn't just only hit the dopamine and the GABA pathway. It also will hit several other areas. And this is where, we get some of the classic symptoms of alcohol intoxication. The cerebral cortex, which is our front, is where we make executive decision making. This is where, why did you do that? I don't know. I was drinking and I wasn't thinking. The reason we use phrases like that is that we lose our ability to actually make great grown-up decisions, to override kind of just instinct and responsiveness. So cerebral cortex is inhibited. Your cerebellum, which is your balance center, this is why we stumble. This is why the police officers on the side of the highway are having people do balance-based testing to see if that's inhibited. And then the hypothalamus, this is our performance center. So running wind sprints or being a great lover usually don't happen when you've consumed too much alcohol, because our performance center really is blunted. But going back to the dopamine pathway, and we've alluded to this, every human behavior that elicits a dopamine response puts it on the table for potential dependence. Because our brain is pleasure pain. Stay alive, avoid pain, then pursue pleasure. On a really basic level, that's where our brain is going. And so the brain is very good at saying, hey, go back to that thing that made me feel good. We notice in people's lives that the things that they struggle with are things that they've kind of always struggled with. There's not a lot of new things, and I term them like the drugs of choice. Yeah. Sometimes it's food, sometimes it's alcohol, sometimes it's pornography, sometimes it's shopping, sometimes it's, whatever the thing is. You go right back into that thing that your brain is like, hey, just go there because we know that'll work. Yeah. But that'll work means give me the dopamine hit that I want. And so now there are good addictions that are non-toxic, like working out, endorphins, closing a great deal at work, convincing a woman to say yes and marry you. There are things that dopamine is a gift, but it can be, when overly stimulated, a gateway into addiction. And so this is why alcohol tends to be very, very addictive, because it's wildly effective at the dopamine pathway.
Yeah.
I think it's important also while we're talking about addiction in our practice, we differentiate between misuse/abuse, where you're using something inappropriately, which many people who consume too much alcohol misuse or abuse it. That is unique and different than addiction. And we're not going to dig deep into those differences, but just to make that distinction. But anything that triggers the dopamine pathway, you know, you're at risk for dependency.
Yeah. What about sleep?
Tell me about sleep.
Negatively affects my sleep. I mean, we've done the podcast on sleep where I talk about being a champion sleeper, love my sleep. But
you have one kryptonite.
That's it. Yeah. Anytime I have like just a drink at dinner or some, overindulge a little bit, heart rate goes up, my Oura ring triggers a really negative sleep score, like in the 70s, which is uncanny for me.
Yeah, you're always in the 90s.
So, just be wary of that, if we do dig into sleep or talk about sleep.
Alcohol, if you're not a good sleeper and you consume alcohol, alcohol's at play. Which
is really kind of counterintuitive because for me personally, it makes me tired. It makes me sleepy. It's that wind down effect, but then totally negatively affects.
This is the
relaxation and the deep sleep that my Oura ring will pick up. Right?
It helps you slide into sleep very effectively, which is why it's seductive.
Yeah.
But the mechanisms and the physiology of falling asleep are different than staying asleep.
Yeah.
It happens to be very, very disruptive in the maintaining of sleep. And this is, so alcohol at night, certainly within 2 hours before bed, there's no way you're not having your sleep impacted by that. And so this is just throwing things out there that might be useful. In this last section, we want to give some action steps and takeaways and this framework about thinking about alcohol, unbiased, I'm not saying whether it's good or bad or right or wrong. You need to decide that for yourself, but here's a framework to think about. And one of the things that I stole from one of my mentors, Dan Sullivan, and I love it because it's a great recentering before you're about to have a heavy talk or a heavy thought, and that is all progress begins with telling the truth.
I love that.
And it really, it's convicting even to my own self. Like we can lie to the world and we can lie to people around us, but we really don't do anybody any good when we lie to ourselves. And so when you're in a state to be honest with yourself, let's have this discussion about alcohol and how it's impacting your health journey. And please be reminded that making a decision or deciding not to make a decision is making a decision.
Yeah.
And so this is something that is impacting your health journey, whether you choose to make any active decision on it or not. It is there. What would you, before we give the action steps, I mean, maybe what would Jen's takeaway from this be? What would be your hope?
I think just helping people really be mindful, like make it more center front in your mind. I think it's one of the pillars that's kind of lost in traditional primary care, or life maybe. I mean, if we have to go more macro, but if your goal, it depends on your goal. If your goal is fat loss, if your goal is better sleep, if your goal is just overall improving your health, then you really have to take an audit of your alcohol consumption. That has to be part of everything. And like you just said, being brutally honest with that. Dr. Hooper, who you've had on the podcast before, I know, in his office, he has shot glasses. He has the actual measurement of alcohol, and he asks his patients, how much do you think you're putting in a drink? And knowingly that they're going to underestimate that. And when they tell him the truth and it's over that, and then knowing it could be more than that, then it's like, okay, we really have to dig into how much you're actually consuming, why you're consuming that. What state are you trying to achieve?
And why aren't you in there?
And why aren't you in there? And can we help you get there without this toxin that's affecting your liver, your sleep, your mental state, possibly your marriage, possibly your work relationships? I mean, it's a big deal.
It's a really big deal, and I think my hopes are very, very similar to yours. I would like people to not feel judged, but also be encouraged to not overlook this. That there is something here to be thought of, and this deserves some thoughtfulness and an honest assessment. And I hope this helps folks take those steps to honestly assess. And I think the basic 4 steps would be, again, the first 2 are really about this whole, like, all progress begins with telling the truth. Be honest about your consumption and your frequency, and to yourself. You don't have to say this to anybody else. Just with you, how much are you consuming, both in volume and in frequency? The thing, number 2 is to be honest about your health goals. Like, are there goals on the horizon that you would like to achieve in your ideal self that you don't realize now? Then I would audit for friction. So step number 3 is, based on those honest assessment of consumption and what your goals are there any friction points, either instinctively or curiosity-wise, or something that maybe was provoked in this talk? Whether it's better sleep, maybe it's, better mood, maybe, am I masking a real problem? Something else is this an avoidance? Is this a numbing, an escapism kind of thing? And dig into those friction points going into step number 4, which is then either make changes or set new goals based on these friction points that lead you towards an achievable goal that maps you towards your ideal self.
Yeah.
And we've talked a lot about goal setting. We've talked a lot about the gap in the gain. We've talked a lot about, using our future ideal self as just the horizon. You're never going to arrive, but you should always pursue it and become closer to it. And I think they need to be your goals. I think they need to be things that are important to you, because at the end of the day, you are the one in control.
Yeah.
And if you go through an honest assessment and an audit, and you're fine with your alcohol consumption as it pertains to your overall health journey, God bless.
Yeah.
Yeah, carry on. But I think it deserves an honest assessment, just like other critical areas of your life deserve honest assessments. And we should never lose the ability to have an honest talk with ourselves about things that are very, very important.
Yeah.
Like, do I have this or does it have me?
Ooh, I like that. It's important.
Yeah. Well, Jen, once again, you're amazing.
Oh, you are. Thanks for putting this talk together.
Well, it's I think
podcast.
I think it's really important.
Yeah, we get asked about it a lot, and
much.
Just the fact that your video a couple years ago still gets a lot of attention. I mean,
every week I get
a
handful of new comments and engagement from total strangers about the content, and we'll link to that video in the show notes. There's a lot more science. It's way more technical. This is a little more heady and a little more coachy and motivational, maybe. But there's a lot here.
Yeah.
And so I hope this is useful, and I hope it provides some framework to do some thinking.
Me too.
All right. We'll see you next time.